What's going on, guys? Tony here. So I'm going to show you how to use this little tape measure and a Sharpie to start measuring improvement when you can't measure range of motion. Let's check it out. Alright guys, so here's what we're going to do. We want to measure improvement. We don't care so much about range of motion in the absolute number sense of the word. And what I mean by that is, you've probably seen my video before where I had a goniometer, which is basically two rulers kind of put together and you can measure joint angles. The problem with that is there's easily a 4 to 5 degree margin of error, which is huge. And so rather than worrying about, am I 90 degrees, 92 degrees, 105 degrees, let's just focus on improvement. Am I getting better? What is the best way for me to measure improvement? What are some things you can do at home today without a therapist to just see if you're getting better? And that's what we're going to do. So one of my favorite ways for somebody to do this at home, I usually will use a waterproof permanent marker. Sometimes if you have marks on your skin already, birthmarks, beauty marks, anything like that, you can just use that. You can also, depending on the size of your incision, just use your incision. When it's healed or if the dressing's over it, however it's done, you need a way to objectively mark the same area today, tomorrow, a week from now. And so marks on your skin tend to work the best, but for this example, I'm just going to use a Sharpie. And usually what I'm looking for is 3 points of contact. So let's say I take one right below what we call the tibial plateau. I'm going to do one right about mid patella, and I'm going to do one just a little bit above the knee. I can measure them if I want. I could say, okay, we're going to go from the middle of the kneecap, that's 10 centimeters above, and I can measure 10 centimeters below. It doesn't matter. Just have some way to find the same exact 3 points, one below, one at, one above your knee, so that your measurements are consistent. And then what you're going to do is you're going to line up the 0 mark on the bottom. You're going to cover the middle mark, and you're going to line up your top mark with whatever number it is. Now for me, right here, it's going to be 20.5. So centimeters, 20.5 centimeters. And what I'm looking for essentially, if I have my leg straight as it can be, I'm at 18 centimeters exactly. As I bend, as long as I don't let the bottom number change, I went from 18 centimeters to 25 centimeters. Exactly. So that is a 7 centimeter change, right? But that's telling me how much flexion I have in the knee. It's not giving me the degree number, but it's measuring improvement. So if on day 1 of taking this measurement, I have 4 centimeters of flexion, then on day 5, it progresses to 6, and then 10, you can see how that's going to give you a measure of improvement. And for me, that's all that I'm really looking for as a therapist. I want you to improve. I want you to be slow and steady, moving in the right direction. You're not going to get improvement every single day. That's totally normal. You're going to have some setbacks. But the whole idea is that as long as over the average, you're moving in the right direction, that's going to be beneficial for you. Guys, this is my quickest, easiest, cheapest hack. And even if you don't have a tape measure, you can just use a string. You can use a shoelace. Take a shoelace out of your shoe, mark it, measure it, flex, and see how much movement you have. And then use those same guidelines to measure it again in a week, in 2 weeks. Don't measure it every day, because there's going to be fluctuations day to day. Look at big picture. Your goal is a year. You want to be back to normal at the end of 12 months. You want to be better than you were at the end of 12 months. So guys, if you have any little tips and tricks, share them in the YouTube comments below this video. Let other people who are earlier in the journey, who might have just had their knee replaced or they're gonna have their knee replaced, let them know what kind of things you've done that worked well for you, so that you could bring a little joy to their rehab process. As always, please subscribe to the video, and I appreciate you. Thank you so much for watching.